heart disease is responsible for over 600,000 deaths in the United States every year. But there are things we can all do to lower our risk of this disease. And in fact, genetics can play a big part and even give us the information that we need to maybe help treat and prevent this disease. Right now, I'm excited to bring into the show today Senior Product Scientist with 23andMe, Alyssa Lehman, and Chief Clinical Officer at Lemonade Health, Dr. Davis Liu. Welcome to you both. How are you?
Doing well. Glad to be here.
Great. Thank you.
So, Alyssa, I want to start with you. You know, so much of the 23andMe, the genetics behind it, we continue to learn different ways to use it. And really, the genetic testing even can have a proactive approach, not a post-diagnosis, but a proactive approach if you are looking at health issues, right?
Yeah, so at 23andMe, what we're looking at is the little bits of DNA that differ from person to person. We call those genetic variants. And some of those genetic variants are associated with a higher chance of developing certain health conditions, including heart disease. And so we look to see if you may have these variants, and therefore if you may have a genetic predisposition to developing heart disease.
I was going to say, so is that how you're able to see if you're predispositioned to that, or specifically what can you tell in our DNA with these tests for heart disease prevention?
Yeah, so specifically we look at, we have about 8 different reports that talk about whether you may have an increased likelihood of developing things like high blood pressure, high cholesterol, coronary artery disease. And so within those reports, you can learn about your genetic predisposition as well as other factors that contribute to your individual chances of developing that condition.
And Dr. Liu, I want to go ahead and get your thoughts on this one here today, because say you do feel or you do get a test like this and you hear that you're predispositioned to heart disease. I'm assuming you've seen patients and talked with patients who are like, yes, this could affect me. What do you tell them to do next? What advice do you give?
First of all, I thank them for coming and talking to me about this and being proactive about their health. It turns out only half of Americans have blood pressure well controlled. It's a silent killer for a reason. So we talk about diet and exercise, we talk about lifestyle changes that are really important, but I also talk about thoughtful use of medications. I talk about blood pressure medicines and cholesterol medicines when necessary and appropriate. It turns out prescription medicines are preventative just as well as diet and exercise. It turns out the leading cause of death, that's heart disease, does not have to be applied to that person in front of me. So talk to your doctor.
I was going to say, just even starting that conversation sounds like it's something that you've been able to hear even in your practice already, right?
Absolutely. I'm so glad that people come in and take a proactive stance on their health. It's so important.
And again, 23andMe continues to evolve. And Alyssa, I want to make sure and send people with information that they know if they want to go get checked for this, because we talk about heart disease today, but there's always so many other things that DNA can tell us, right?
Yeah, absolutely. We're constantly learning more. And so if people are interested in learning more about, what we offer from, health, both about health conditions, but also about your ancestry, they can visit 23andme.com to learn more information.
You know, Alyssa, I think it's just been really cool. I remember when things like this came on the market, 23andMe, and it was all for ancestors. And I feel like now, just as the years have gone by, as the technology continues to evolve, it's opened up to all of this hereditary and disease help as well.
Absolutely. We're constantly learning about the meaning of these genetic variants and what they can tell us about our health and all kinds of health conditions.
Nice. Alyssa, Davis, thank you again to both of you for being with us today and talking about this. I think it's always just so fascinating. And if we can help people be proactive, it's always so important. Take care, okay?